Hello, in this video, I'm going to tell you all about ACL injuries. So first off, what is an ACL injury? So we are talking about the anterior cruciate ligament of the knee. So an ACL injury would be some overstretching or tearing of the ACL ligament. In this picture, it's this ligament right here in the anterior, so the front part of the center of the knee. Cruciate refers to crossed. So we have the anterior cruciate and the posterior cruciate ligaments that are two ligaments in the center of the knee that sort of cross like that. And that's why we call them the cruciate ligaments. So the ACL stabilizes against anterior translation of the tibia relative to the femur. So meaning the tibia moving in the forward direction relative to the femur staying still. It also stabilizes against internal and external rotation of the tibia relative to the femur and hyperextension of the knee joint. Plus, it stabilizes against both varus and valgus forces. If you need a review of what those terms mean, I linked a video explanation in the description below. So signs and symptoms of an ACL injury. So if it is sprained, meaning that it's overstretched but not necessarily torn, then you will experience tenderness, swelling, some pain, and some limit to mobility, but you should still be able to bear weight and have some amount of motion. If it is a grade 3 ACL injury, meaning that it's torn, then it's a lot more severe at that point. The patient often will hear or feel a pop when the injury occurs. It's a very common report when you're getting the story of what happened. The person will also immediately lose function. They'll have difficulty or total inability to bear weight. It'll be very painful. It will swell extremely quickly, and they will lose range of motion. So how do ACL injuries usually happen? By far, the most common way is that it's non-contact torsional stress. So meaning non-contact, like it wasn't like somebody pushed you or you slammed your knee into something, nothing like that, non-contact. And then torsional, meaning like a twist. So it's when the tibia twists relative to the femur. So in sports, we see this most often when we have some kind of cut or spin kind of move where the person's foot is planted, and you probably are wearing cleats. So you've got a cleat planted in the grass, and then you turn to cut and move in the other direction. So your femur turns with the rest of your body where your foot and your tibia stay rooted and planted in place. So then you get this kind of twisting that takes place between the femur and the tibia. And that's what we mean by non-contact torsional stress. So that's the most common cause, but it also can be caused by any force that causes anterior displacement of the tibia relative to the femur. So that could be like a kick in the back of the calf that's pushing the tibia in the forward direction relative to the femur. That type of injury is also likely to damage the PCL, the posterior cruciate ligament. So that will be determined by your doctor, and you need to go in and get it checked out if you have experienced an injury like that. It also can be damaged by hyperextension. So extension would just be to the neutral plane, so flexion, extension. And if we go past neutral in the wrong direction, then that is hyperextension and is very damaging for the ACL and the whole posterior joint capsule. All right, so severities of ACL injury. So grade 1 is the most mild. So there's been some overstretching. There's a sprain of the ligament, but the ACL is still intact and provides stability for the joint. Grade 2 is worse. It's stretched. It might be partially torn, moderate damage, but a grade 2 is actually pretty rare. For the most part, ACLs either have a mild sprain or they completely rupture. The in-between is not seen nearly as often. Grade 3 is where we have a complete tear so that the ACL is no longer providing any stability for the joint. So treatments, what do we do when there's an ACL injury? So if it's grade 1, so it's just sort of a mild sprain, then it's treated non-surgically. First, there's basic first aid, rest, ice compression, elevation. Then it will likely need to be immobilized with some kind of splint or brace. Physical therapy will be helpful, and then gradual progression to return to normal activity and sports. Grade 2, again, are pretty rare. The treatment is going to depend on the nature of the injury, because if it's partially sprained, there might be a partial tear. Depending on exactly what is torn, what the symptoms are, how severe the tear is, it might be treated non-surgically to see if it improves, and it may ultimately require surgery, just depending on how it goes with the non-surgical treatment. But again, that's a pretty rare case. For grade 3, it would require surgical treatment. So there's surgery options that'll depend on the type of ACL injury. So exactly where in the ligament was it damaged, or how exactly was it damaged, and whether the growth plates are open or closed. So in children who are still growing, the growth plates are still open, and they would be treated differently from adults where the growth plates are already closed and they are done growing. So that will partly determine what kind of surgery or how the injury is treated. All right. Thank you so much for watching this video, and hope you have a great day.